We'll slowly start the morning's rounds. Thank you all for joining. Um, Leanne is on her way to a conference, so she asked if I just would start it off myself this morning. I would have the great privilege to get you all excited with Larry about our launching the Pulse 360 initiative that some of our department leaders have already gone through. And now we're opening it up to all the attendings for the Department of Surgery to take part in this really important feedback program for ourselves and our colleagues. Um, it's called Pulse 360, and we're using this program because it's a very well-known physician feedback program that is used widely across many different hospitals, and both in the United States and in Canada. And I think Larry will touch on where he's deployed these programs, as well as other departments in McGill itself. The purpose of the program, the Pulse 360 program, is to get helpful feedback. It's not an evaluation, it's not a test or a rating scale. It's really just personal feedback about your communication, your leadership, and your teamwork style. So without further ado, I'm going to ask Larry to start his presentation. He is actually an associate professor at the University of Miami, the School of Medicine, in the departments both of medical education as well as psychiatry. So he's has high expertise in this feedback domain. And he'll be doing a presentation and a short video, and then we'll have Dr. Chater talk about a little bit of her experience with her own Pulse 360 about feedback session, and then we'll have any questions that you want to ask along the way. So you know what to do when you get that invitation to start your own feedback session. So Mary, I'll leave it to you.
Thanks, Shannon, and good morning to everybody. Thanks for joining at this early hour. You all are surgeons, so while it might be an early hour for me as a psychologist, it's practically lunchtime for you all because I know how early you all get up. What I'm going to do is give you an overview of the Pulse 360 program. And my goal will be to answer a lot of the questions that you might have about physician feedback programs. I'll also show you some outcome data, both published as well as our own internal data. Much of it will come from the Harvard system, where we have a number of different programs. But as Shannon said, I hope you'll ask questions. You might want to jot down a question. If somebody has a burning question while I'm presenting, I'm happy. Feel free to interrupt me. That's perfectly fine. So let me go ahead and do the most challenging part of this morning, which is switching to screen share on Zoom. So let me go ahead and do that. And just switching things around here. There we go. Okay. And you should all see Pulse 360 program. Do y'all see that? Just shout out yes.
Yes, we do.
Great. So,
but you're not in presenter mode.
Actually, I'm showing a PDF.
Perfect.
So you should see the next slide now, correct?
Yes.
Great. So anyway, just quick overview of Pulse 360. We've had well over 15,000 physicians and other healthcare professionals who have received Pulse 360 feedback from a large number of general hospitals and academic medical centers across both the States as well as Canada. I'll show you some from Canada in a moment. We have about 1 million surveys in our database at this point in time, partly because we've had about 22 years of refining the program, implementing it, changing it, improving it. And so at this point, we feel that it's quite relevant. It works. It provides developmental, formative, helpful feedback for surgeons and other physicians. And of course, many of the questions correlate significantly with various outcomes, like patient experience, for example. So I thought that one of the most important points that I wanted to share was what a Pulse 360 survey report looks like. So this is a summary. Now, a couple things you see here that this surgeon received feedback from 16 raters. The larger the N of raters, the richer, the more helpful, the more meaningful your feedback will be. You will be compared, of course, with our norm for Canadian surgeons. Here's some of the US and Canadian hospitals and academic medical centers from which we get our norms. As you can see, let's see, we have a program going on in one of the surgery departments at British Columbia Children's Hospital. Most of the CMPA leadership a while back did the Pulse 360 program themselves. At IWK, we've done their surgery department. Interestingly, at McGill, a number of years ago, we did your medical advisory committee and several different departments at that time. Since then, as Shannon mentioned, we've also, let's see, in the last year or so, we've done radiation oncology, one of the emergency medicine sites, the Jewish hospital, all of their physicians and physician leaders have done the program, et cetera, et cetera. And also, most importantly, many of you have had an opportunity to give Pulse 360 feedback to your departmental leaders. And that's always a best practice because it gives you a sense of what giving feedback is like, so that when you receive the feedback, you're already familiar with the process. At University of Ottawa, by the way, almost all residents get Pulse 360 feedback at the beginning of end of PGY1, beginning of 2, and then in their last year. And that's a program that's been going on for about, 10, 12 years now. Now, this is a sample Pulse 360 summary. You can see here, this is this surgeon's self-rating. You can see that physicians scored this surgeon a bit higher, and healthcare staff had some variability. This particular surgeon believes that it's a he, that he doesn't listen to others as well as he'd like, and so he scored himself honestly and a bit lower. But what's quite fascinating here is that the other two groups perceive that his listening skills are quite good. So this gives you just a sense of what a Pulse 360 summary looks like, at least in terms of the graph page. However, this is what we call the color-coded page. Now, green is great. Green means you're above the 80th percentile on these behaviors, for example, listening, et cetera, et cetera. This is mid-range. And then yellow or red indicates that it's below average. And again, this is compared to our Canadian surgeon norms. Now, I love numbers. They're wonderful to analyze. They have a sense of objectivity about them. However, it is the anecdotal narrative comments that raters give you that's going to provide you with the most helpful, meaningful, and actionable feedback. What our AI system does now, as of January 1st, is it organizes all of the comments into the number one theme, the second most frequent theme, third, etc. It does something which is really quite fascinating. It analyzes every comment, and if there are any individual unique writing styles of the rater, then it will standardize the writing style. So I'll give you an example. I tend to leave out the first letter. I tend to not capitalize the first letter of sentences because I'm in a hurry and I forget to press shift. And if I did that, AI would automatically capitalize the first letter of the sentence. In other words, if it didn't, and you saw a lowercase first letter of a sentence, you might think it's me. And then I wouldn't have anonymity. So it goes, and it goes beyond that. It kind of standardizes the writing style in order to protect the anonymity of raters while at the same time, and this is important, preserving the content of the message. So you get the message, but it's not written in a style that's unique to that particular rater. It also means that when you give feedback to your colleagues, that you can feel quite reassured that you will maintain your anonymity, which is important for the psychological safety of all raters in order to give candid feedback. Now, this is just a quick overview. We're doing the orientation now. The physician will be emailed a link, and that link will have a directory where they can select raters. The chief, Shannon, or vice chief, or whomever is designated as the validator, looks at the list and has the option of adding any missing names. This is our validation procedure. Once she clicks approved, that automatically launches the surveys and they're active for 21 days, during which time you do your self-assessment. And by the way, try to be honest when you do your self-assessment. And then, of course, you get rater feedback. Now, common question that comes up is, how long does it take to do a Pulse 360 survey? And for those of you who have given feedback, you know that it takes about couple minutes. Once the pulse report is done after 3 weeks, then we prepare a pulse report and it's previewed by the chief, who's our validator. And then you'll get an invitation to set up a time with one of the pulse coaches to review your feedback and to set developmental excellence goals. So a couple things. I mentioned developmental excellence goals because fundamentally the Pulse 360 program is formative. It's designed to help physicians improve. In a study in the Journal of the American College of Surgeons, co-authored by the chiefs and chairs of the Harvard-affiliated surgery departments like Mass General and Brigham and Women's, you can see that the overall perception of the program was that it was accurate. 87% of the surgeons thought the feedback was accurate. And these are Harvard surgeons, so they're a pretty credible group. 80% of the chiefs and chairs thought that the feedback was accurate. It was well received, and it was perceived and used as a formative developmental and educational tool. 60% of the chiefs and chairs noted that the physicians had improved. Now, in a different study, one that I co-authored, we found that those physicians, and this was from a US and Canadian cohort of about 1,000 physicians, that combined with goal setting, coaching, educational modules, that those physicians who participated in that particular program improved over 50%. But I think one of the most important outcomes is that, and it's not data-based, it's anecdotal, that about 85% of physicians receive positive feedback. Now, that doesn't mean there aren't suggestions for improvement, but that there's a solid group of positive feedback in the comments and in the color-coded scores. And that's highly morale boosting. We know how difficult it is to be a surgeon these days. Well, it's always been difficult being a surgeon. These days, I think it's particularly difficult. And getting pat on the back feedback, validation, appreciation is really quite morale boosting. Now, one question that's often asked is, do physicians improve? Um, this is from essentially the CMPA of the Harvard hospitals. They have given us, actually, they've given us 3 grants over the last 10, 12 years. Our current grant from the risk, and it's called CRICO, but it's really the Risk Management Foundation of the Harvard Medical Institutions. They gave us a grant to roll out the program in most of the 26 Harvard affiliated hospitals. And what they found was that after the first 700, that coaching, that those who received coaching, debriefing, coaching, that it demonstrated a significant improvement in their interpersonal style. When we drill down and we look at some actual numbers, here's what we find. And by the way, these findings are replicated in almost every large group that we analyze. The top third in any large group will not show any significant improvement. The bottom third, however, do show about an 8% improvement, and that is significant with p-values less than 0.01. And the bottom 10%, often the best and the brightest, who are so focused on fine-tuning and honing their technical skills, they may overlook some of the interpersonal stuff. Their improvement was 17%. So leading to a conclusion that we see over and over again, that the lower your score, the greater your improvement. Now, this is another study, one that I co-authored in the journal Surgery. And I'm giving you a lot of the surgery journal studies, obviously. What we found is that surgeons, when compared to family medicine, other specialists, surgeons actually showed the greatest mean improvement, 9 points on our scale. Whereas medicine specialists, for example, had a mean increase of 6.7 index points in terms of teamwork index, for example. Again, in this study, those who start with the lowest scores have the greatest potential and the greatest improvement. So when we drill down and we look at which behaviors, and this also gives you a little bit more information about the questions, again, you'll see that the bottom third in this particular study, which included both US and Canadian physicians, the bottom third showed significant improvement with the insight question, responding to conflict by trying to work out solutions, treating team members with respect. But in this particular study, the middle third also showed highly significant improvement. So overall, physicians are bright. When they get feedback, they understand it. They often didn't realize it, and they make improvements. Now, a big question comes up often as to whether or not the improvement is sustained. And the answer, this is one large Harvard hospital where we've been doing the Pulse 360 actually for 10 years, but in the last 5 or 6 years, we've standardized the process throughout the hospital. And you can see that on a scale called Teamwork Index Scores, which is a rough metric for the CanMed's core competencies of professionalism, collaboration, and communication. You can see that over the last 5, 6 years, the improvement went up about 7 points, and it was clearly sustained. Of course, during COVID, we saw a little bit of a decline, but bounced back quite quickly. I'll just wrap up this portion by mentioning that the American Board of Thoracic Surgery now requires all residents applying for board certification to do the Pulse 360 program. And we've put in our contract that it cannot be used to determine whether or not a resident becomes board certified. It's instead a mandatory educational activity that is required. And the idea is to provide them a valuable tool to receive feedback on their strengths and any opportunities for improvement. So it's being done at the resident level in the United States, for example, for thoracic and cardiothoracic surgeons, and University of Ottawa, for example. And this is just a survey we did a while back of physicians who participated. And one of the things that we value is feedback about our coaches. And as you can see, 94% of the physicians agreed or moderately agreed that their coach was supportive, helped provide insight into how they're perceived by others, supported the development of their excellence goals, and that they would recommend their coach. One last thing, which we just find very interesting. So we went and we looked at how physicians scored on the pulse, and then we looked at the feedback we received about how that physician liked or didn't like pulse. And what we find is probably not surprising. There's a very high correlation between when you get favorable feedback on the pulse and whether you feel that the pulse is a favorable program or a positive program. So if you get high scores on the pulse, you're statistically far more likely to give high scores to pulse about the program. And with that, let me go ahead and wrap up. Let me get out of screen share here. And whoops, there we go. Great. Okay. So, Shannon, I think you were going to introduce Dr. Shader.
Yeah, just before I ask Dr. Chater to give her feedback about what her experience was like, maybe just we'll walk through a little bit more operational nuts and bolts of how people will be receiving their invitation and what they actually have to do in order to participate.
Sure. Let me go ahead and show the video now. And this way you'll be able to see. It's a 5-minute video that's designed to answer the most frequently asked questions. Some of it is a recap. And again, just let me know, give me a thumbs up if you can hear it and see it okay. Great.
Welcome to the Pulse 360 program. This video will answer the 7 most frequently asked questions. First off, what exactly is Pulse? Pulse is a 360-degree survey feedback program that has been used at academic medical centers such as University of Ottawa, University Health Network, Hospital for Sick Children, McMaster, Dalhousie, Johns Hopkins, Yale, University of Michigan, UCLA, and over 10 Harvard-affiliated hospitals, including Mass General, Brigham and Women's, and Beth Israel Deaconess, as well as other academic and community medical centers. Pulse is a good to great program and an opportunity to get helpful good to great feedback. Pulse stands for Physicians Universal Leadership Skills Education, and across more than 2 decades, about 15,000 physicians, leaders, providers, residents, and other healthcare professionals across more than 700 facilities have received feedback from nearly 1 million Pulse surveys across the US and Canada. Here's how the feedback program works. Pulse will email you a link so your designated leader and you can select your raters. Shortly after your leader augments and validates your list of raters, Pulse will email you the survey to score yourself. Make sure to score yourself the way you honestly think you are, not the way you think others might score you. What are some of the Pulse 360 questions? There will be questions such as treats team members with respect, keeps team members informed, and communicates clear expectations. How do I get my feedback? Once your feedback is finalized and approved by your designated leader, we'll send you an email with a link to an online calendar so that you can schedule a convenient time to receive your feedback from one of the Pulse coaches and begin your debriefing. The Pulse coach will then review your feedback with you and help you select a few good to great excellence goals, which will be copied to your designated leader and then emailed periodically to you as helpful reminders and reinforcers. All coaches are trained in Pulse's feedback-assisted coaching and education model, have extensively coached healthcare professionals, and are either certified coaches or have at least a master's degree in psychology, healthcare, or education. If you have any outlying scores, your Pulse coach may discuss a development plan for any follow-up calls and brief online educational modules. What does a Pulse 360 summary report look like? Here's the cover page of a sample Pulse 360 report. The cover page shows how many raters gave you feedback, as well as the benchmark comparison group being used. We call this the graph page. This is an aerial view where you can see how your self-rating flows in comparison to the ratings of others. This is the color-coded page. Green is great. Green means you scored more than about +1 standard deviation above the comparison mean. If there's no color, it means you've scored mid-range, between +1 and -1 standard deviations. Yellow means it's below -1, but not more than -2, which means caution. If it's more than about -2 standard deviations below the mean, then it's highlighted in red. The last section of the Pulse report shows your raters' written comments that may be clustered into themes. How does Pulse provide fair feedback? Pulse strongly believes that for a feedback system to be effective, it also has to be fair. First, we ask each rater how often they work with you, which is called the familiarity index. Next, algorithms determine if any scores are based on limited data. Your Pulse report will not display a score based on 1 or 2 raters. Next is inappropriate or non-constructive comment deleted, which means that Pulse, as well as your designated leader, may delete comments deemed to be highly inappropriate, that may say more about the rater than you, or overly divulge the rater's identity. Finally, our system looks for rogue raters. These are raters who appear to be providing extremely harsh ratings, and Pulse may remove that rater's feedback. How can you give fair feedback? In addition to receiving feedback, many of you will be giving feedback, and giving fair feedback is easy. Most Pulse surveys are short, so it should only take 1 to 2 minutes, and make sure to follow the ABCs. Stay anonymous by not writing comments that identify you. Give balanced feedback, which gives credit where credit is due, but also lets the individual know specifically what they can do to be a better team member. Describe changeable behaviors that a motivated person could improve. Be selective and sensitive about your comments. In other words, don't unload everything under the sun you might want to say. Remember that about 85% score quite well and get favorable feedback. Given how challenging working in healthcare can be these days, a pat on the back goes a long way.
Okay. So that video is designed to answer most frequently asked questions. I'll just add a couple of other things. So you all will have 3 rater groups. The first group are physicians and I believe allied, and you'll be asked to select at least 5 from the directory of physicians and allied. Next group are nurses and staff, and you'll also be asked to select at least 5 of those. But 5 is a floor. Try to select 10 at least, maybe even 12 or 15. And ideally, you want to select a bell-shaped curve of raters. I know it's human nature to select your best friends, the nicest people, but this is an opportunity for you to get developmental feedback. So try to select grumpy people, because they often will give you the most helpful feedback. people who tend to be blunt, people who tend to be very candid. So try again to select the bell-shaped curve. Now, the third group are trainees, but we set the minimum to be 0 because some of you don't work with trainees or you don't oversee trainees. So, but again, try to select all the trainees with whom you work because trainees are reluctant to give feedback. And by adding a large number of trainees, you're more likely to get some solid feedback from them if the N is high enough. So I think, Shannon, did I leave out anything that might be helpful for them to know?
No, I think you covered a lot of it. Just to touch on one point, the plan is to send some invitations out as of Monday, but not all 105 of you will receive an invitation on Monday. It would just be a little overwhelming for everybody trying to give feedback and to the validators, etc. So I think our plan is to invite, I think, somewhere between 20 to 30 people a week. So you might not receive your invitation till towards the end of May at that rate, but we're trying to get everybody invited in the coming month. And I think it's if Ruth is available, we'll ask her to just give us a little bit of what she thought the process was like and how she found the feedback useful or not.
Hi, good morning. Sorry, I'm getting my tires changed this morning, so I'm standing in a. When this was first introduced for the surgical leaders at McGill, I think, being an older surgeon, I was a little apprehensive. No one likes to be told, that they're not nice or everybody worries about how other people perceives them. So I was a little apprehensive going into the whole process. We were also the first in the group to be evaluated. And so it was kind of like going into the unknown. And again, being older, it's I think you're a little bit more reluctant to go into new things. That being said, it's a painless process. So I think you have to think about who you're going to select as your evaluators. I think, as was said, I don't pick people because they're nice or they're going to give you a good feedback. Pick people that potentially are going to give you more harsh feedback, but maybe don't pick someone who really doesn't like you because that may be not fair feedback either. Overall, once you get your evaluation back, I think it's a painless process. You have someone who goes through your evaluation point by point. There are there are positive things about getting told that maybe you could do this better or you could do that better. I think that is always helpful. I think the reminders that we got intermittently to do the things that we came up with that we were going to do to improve our behavior or how we deal with things. I think those reminders were good. Overall, I think the experience is excellent. I think it does improve your behavior. You stop and think and say, okay, maybe I should do this a little different or whatever. But I think overall, it is a very positive experience. And I think it does help you grow as a person and as a surgeon. So I don't know if anyone's got any questions about how they, how I felt about certain aspects or whatever.
Thanks, Ruth. I think that was super helpful quite insightful. There's not too many opportunities for us senior surgeons to get feedback other than our 145 reports from our trainees, which are often unhelpful and not specific and maybe not actionable. So I think this is a great opportunity to get some feedback from the sort of everybody we work with during the day. So I think if we go in with the mindset that it's an opportunity and it's with some curiosity, I think that's going to be the most helpful. The coaching modules are also, an opportunity to work on things then when you potentially had a blind spot or something that that is you are able to work on. So again, not many people get these sort of insights from their colleagues in an anonymous way that's sort of lower risk. But it is still kind of scary to ask somebody what they think of you. So I appreciate your candor about your experience, and I think going into it with the curiosity mindset is the key. Does anybody have any questions at this point?
I just wanted to add a comment about what Ruth said. If any of you listening to this orientation are apprehensive, as Ruth said, she was apprehensive before she did it. What that tells me as a psychologist is that you're normal. That's a good thing. It shows that you care. It shows that you have some level of humbleness. It shows that you're wondering about how you're perceived and you're unsure. And so the feedback you receive is going to, first of all, very few people are apprehensive after they receive feedback. It's like, oh, okay, that wasn't such a big deal. Not so surprised, et cetera, et cetera, et cetera. So apprehension is normal. It's good. It's a positive quality. I'd love to hear what questions anyone has, what concerns you might have. And in particular, what are your comments? What are you thinking? Well, I guess we've answered all their questions.
They're usually not such a shy group, but I'm sure as they come up, they're more than welcome to send me an email, and I can, if there's something I can't answer, then I'll definitely ask you, Larry, for your feedback. That's one of the best parts of this program is that the responsiveness of your group. I do see something in the chat from Jason.
Okay.
Anonymity is important, but what evidence of validity do you have that anonymity and the content of the message are preserved with the new AI tool?
Well, that's a great question because we shifted to AI on January 1st, so we don't have enough time under our belt in order to analyze it in terms of validity. But just eyeballing sort of side by side what the original comments are and what the AI comments are, you look at it and you say, okay, that makes sense. Certain idiosyncratic words that are unique tend to be eliminated. And you look at it and you say, well, that's the same message. So while I can't give you data on the validity of the AI process, it's really not that different than our old system, except that it's more standard. The comments are more standardized. And the other thing that I particularly like about our new AI system is that it takes, if somebody maybe has some frustration towards a physician, it kind of neutralizes a little bit of the tone, but instead conveys the message. So again, I wish I had validity data, but I can tell you anecdotally, because we've been doing this now for what, 4 months, and we look at the comments periodically side by side, and they're really quite similar. One thing that I think is important is that it organizes it into themes. So when you get your feedback and you're going over your feedback with one of the Pulse coaches, I mean, you just look at major theme, the top theme, number one, and that is the area to start doing more of. You look at the stop comments and stop theme number one. Well, that's something you want to do less of. So it provides a lot more clarity. But again, to your point, to your excellent question, we don't have data at this point.
And just as I comment as the validator for the comments, as well as the raters for the first group that went through, I think maybe it's a Canadian thing, maybe it's a McGill thing. There were very few comments that I had to throw out or edit. People are generally very fair in their feedback and actually provide very actionable feedback. So then the AI perhaps smooths out some of the language and provides more anonymity, but I'm not sure that there's how much of an effect. I don't think there's great effect, certainly in the group that went through for us prior to it.
It's mostly about tone. Yeah.
Well, thank you very much, Larry. It was really a pleasure to see you again and have you back to help roll out this new program for everyone. As you mentioned, I hope you feel comfortable sending me an email if you have other questions, and if I can't answer, then we'll get Larry too. And I hope you're looking forward to the opportunity to gain some insight into the way we interact with people. For many of us, it might be the only opportunity we have in a long time. So I encourage you to participate and add as many raters as possible, because as you know, not everybody's going to respond to the invitation. Sometimes it ends up in the junk box. So the more people you ask, the better your feedback will be.
And as Shannon said, please forward any questions to her. Or if you don't have a question, you just want to talk with me, let Shannon know and we'll set up a time and I'll call you or we'll do a video conference. My goal is to make sure that all of your questions are answered because, again, just to reiterate, human nature is people are going to be apprehensive the first time they do it. After you've done it once, it's no big deal. I can reassure you.
Oh, I see Ruth has her hand up. Go ahead, Ruth.
I just wanted to add that if anyone had any questions, if they just wanted to talk to me about the process or anything like that, I have an open door policy in my office, and anyone's welcome to contact me, and I'd be happy to walk them through it and tell them about the experience and all that sort of thing.
And by the way, Ruth's description of her experience is quite typical, and it's reasonably close to what you would expect. Apprehension and then greater insight. And we all want to wish that Ruth gets her tires changed smoothly and that you drive carefully.
Thank you, everyone. I wish you a wonderful day and enjoy the sunshine if you can later. Take care.
Thank you.
Thanks again to Ruth and Shannon. Bye-bye,
and
everyone.
I have my tires on.
Yay! Bravo. Très bien.
Bye.